At the end of this session, students should be able to identify and demonstrate the important surface landmarks of anterior aspect of the upper limb. The surface landmarks from the anterior aspect of superior extremity includes clavicle, jugular notch, sternal angle, anterior axillary fold, coracoid process, tip of acromion, greater and lesser tuberosity of humerus, insertion of deltoid muscle, tendon of biceps brachii, lateral and medial epicondyle of humerus, lower end and styloid process of radius, tubercle of scaphoid, crest of trapezium, pisiform bone, hook of hamate, metacarpal heads, tendons of palmaris longus, flexor carpi radialis, and tendon of flexor carpi ulnaris. First, we'll see how to feel for the clavicle. Clavicle is also called as the collarbone. It lies horizontally between the sternum and the scapula. So to feel for the clavicle, touch the area between the neck and the shoulder. Jugular notch. It is the visible dip in between the neck in humans between the clavicles. To feel the jugular or the suprasternal notch, place an index or middle finger on the superior border of manubrium sterni and feel for the notch. This notch lies at second and third vertebral levels. Clinical significance of this notch is if there is a prominent pulse at this region, it may be indicative of uncoiled aorta, arch aneurysm, or a tortuous blood vessel. The sternal angle, otherwise also called as the angle of Lewis, it can be easily felt as a ridge by running the finger downwards on the sternum from the suprasternal notch. Importance of this landmark is if you trace laterally, this leads to the second costal cartilage that in turn articulates with the second rib. The ribs can be counted from the second costal cartilage onwards. The anterior axillary and the posterior axillary folds. The anterior axillary fold is formed by the lower border of the muscle of pectoral region, that is pectoralis major. And the posterior axillary fold is formed by the latissimus dorsi muscle. These anterior and posterior axillary folds, it contributes to form the anterior and posterior wall of the axilla. So these axillary walls are used as landmarks by the surgeons to prevent damage to the neurovascular structures within the axilla during the surgery. Coming to the coracoid process of the scapula. About 2.5 centimeters vertically below the junction of the lateral fourth and medial 3/4 of the clavicle, you feel for the coracoid process of the scapula. The pain in this region indicates an insertion tendinopathy of short head of biceps, pectoralis minor, or coracobrachialis muscle, because these muscles, it receives the insertion into the coracoid process. Tip of acromion. To feel for this tip of acromion process, it can be easily felt lateral to the acromyoclavicular joint. The greater tuberosity of humerus can be felt as the most lateral bony point in the rounded contour of the shoulder region that is covered by the deltoid muscle. The lesser tuberosity of humerus, it can be felt 3 centimeters below the tip of acromion. So first you have to feel for the tip of acromion process on the anterior aspect of the shoulder region. Insertion of the deltoid muscle. So this muscle, it forms the rounded contour of the shoulder. The insertion of this muscle can be identified when the arm is maintained in the abducted position. So it is halfway down the lateral aspect of the humerus. Now the next muscle what we are going to feel is for the tendon of the biceps brachii. So, tendon of biceps can be felt when the elbow is flexed. The tendon can be grasped in the cubital fossa. The lateral epicondyle of the humerus. This is located on very lateral point of the elbow, a bony ridge structure, and is readily palpable in the upper part of depression on the lateral side of the olecranon process. The medial epicondyle of the humerus. This can be easily felt as a conspicuous landmark on the medial side of the flexed elbow. The lower end of radius, little elevation on the lateral side of the wrist, about 1 centimeter above the base of the thenar eminence. The styloid process of the radius is palpable by following the lower part of the lateral border of radius downwards, about 1.25 centimeters below and slightly on the more anterior plane than the styloid process of ulna. The tubercle of scaphoid. It is situated in the base of the thenar eminence, hidden by the tendons of the flexor carpi radialis muscle. Once the styloid process of radius is felt, move the finger medially and feel for the scaphoid tubercle. Crest of trapezium. This can be easily felt by applying pressure over the thenar muscles about 2 centimeters below the tubercle of the scaphoid. The pisiform bone forms an elevation on the medial part of the base of hypothenar muscles. So it receives the insertion of flexor carpi ulnaris. Hook of Hammett is palpable by gentle pressure through the hypothenar eminence about 2 centimeters below the pisiform bone. Lies within the ulnar border of the ring finger. Metacarpal heads forms the prominence of the knuckle and the most prominent is of middle finger. Tendons of palmaris longus and flexor carpi radialis. So when the wrist joint is flexed against the resistance, two tendons become prominent on the lateral side of the front of the wrist. The lateral one for the flexor carpi radialis and the medial one for the palmaris longus. The tendon of flexor carpi ulnaris. This muscle tendon stands out prominently along the medial side of the front of the wrist when the joint is flexed against the resistance. When the tendon is traced downwards, it reaches the pisiform bone.